We're now on to learning unit number 3, professional development and education. We're going to take a step away from emotional intelligence this week to learn a little bit more information about professional development and to think about what we want to do in the future. So for this learning unit, there's a quote that I really enjoy about being afraid of change. And I know that you're not afraid of change as you entered into this master's program, as you complete it this semester or shortly thereafter. But we're going to talk about professional development plan, an individualized professional development plan. This is really a big part of your final course reflection, which is due in learning unit number 6. So we're going to go over the information in this learning unit, and by the end of learning unit number 6, you're going to have completed your own professional development plan. When we talk about professional development, we're talking about doctoral programs, such as the doctorate in nursing practice or the PhD. We're also talking about professional nursing organization membership and or certification. So there's really 3 areas. Some of you may be interested in all 3, pursuing a doctoral degree in the future, pursuing professional nursing organization membership. Many of you might be already members of professional nursing organizations and pursuing different certifications. We're going to take a look at 2. It's the American Organization for Nursing Leadership, AONL, certifications this week. We're going to go over our Certified Professional and Patient Safety certification a little bit more in our next learning unit. But we're going to look at the 2 AONL certifications this week. So you're watching this video. There's going to be information, again, no readings in your text for this week, but there's going to be some readings, a lot you can kind of skim through, not real intense peer-reviewed journal articles, but information on doctoral education, professional nursing organizations, and certifications. So you're going to complete your discussion board post, and do that by Friday. Excuse me, I don't know why it's saying Thursday here. I'll change that to Friday. But no replies are required. But I do hope that you read one of your classmates' posts. So that's our learning goals and objectives you can read. You're watching this video, and then you see there's 3 different folders as we spoke to. So the first one's on doctoral education, and it compares and contrasts the 2 main doctoral programs, doctorate in philosophy and doctorate in nursing practice. And you're going to find that the information within is going to talk about the doctorate in nursing practice as a clinical practice doctorate. And you're going to be doing, you would be doing a project. And in the PhD, that's a research-focused doctoral degree, and you would be doing a doctoral dissertation, original research. In the DNP, you would be using evidence-based practice. So it goes on, and you'll see in the different sources that are available there to you, it'll be as far as even time allotment, and there is a link to different programs so that you can look for a program of your choice based on state, perhaps. Then more information about the doctorate in nursing practice, again, a practice doctorate. So you will look at information on the DNP. And this is comparing PhD and other research-focused nursing doctorates. So the EDD, Doctorate in Education, and the PhD are very similar in that you do complete a dissertation, your full research. They are both research-focused. There is another doctoral program that it'll explain that is a research-focused doctorate. And then the doctoral programs throughout the U.S. And the last is an interesting article from last year, Trends in Nursing PhD Programs. So you're going to see how PhD program graduate numbers are going down, DNP numbers are going way up. And the next, so that's all in the folder on doctoral education. The next one is on professional nursing organizations. Here's just a simple quote about collaboration. But then some of the top professional nursing organizations. A list of professional nursing organizations. We have a large list of both national, state, and international nursing, professional nursing organizations. What Erie is lacking, I don't know about where you live, but what Erie is lacking is few local chapters that are active. So at Mercyhurst, we started our own local chapter of the American Holistic Nursing Association. It's called the Lake Erie chapter of the American Holistic Nursing Association. And we have combined this chapter to be one for registered nurses in the community, as well as our nursing students. And at Mercyhurst, we have from the LPN program through the master's nursing students. So anyone is welcome to attend, and there isn't a fee. If you want to see check our Facebook page, I've given you the link for that. And then the final, so that's it with the professional nursing organizations. And the final folder has some information on certifications. So there are many different nursing certifications you can look through, and I'm just coming to a complete list. You have to scroll through the ads first, okay? So we just saw these ads for universities. This is the complete list of nursing certifications, both the type of certification, the credentialing. So if you're looking at somebody's, alphabet soup after their name and you're not sure what credentials they really have, this is a nice place to look it up. You can Google it as well. But all different certifications are listed here. It's a very robust list. So that is a great list of nursing certifications. You'll note our certified professional and patient safety, what we're going to talk more about, and what we did talk about in Nursing 573 is not listed. Why is that? Because that is a certification that's for nurses, but it's also for non-nursing healthcare providers such as physicians and masters in healthcare administration. So we're going to talk a little bit more, as I said, about the CPPS in our next learning module, and we had spoken about it in last summer's course. There is a literature review on nursing certification. I put this in there in case you're interested. One of our previous grads wrote this up, and it's quite informative. So if you want to know a little bit more about nursing certification, what does the evidence show about nursing certification? Again, one of our graduates and a current nursing faculty member here at Mercyhurst did a lit review on nursing certification. So you may find that very helpful. And then we're looking at the AONL certification. Now, again, that's the American Organization for Nursing Leadership. You are in a program and completing a program of integrative health and healing and nursing leadership. So this is, along with the CPPS, this is the one certification exam that you're going to be I would imagine most of you would be very interested in. Now, there's two possible certifications for nurse leaders, and it's all based on the length of your leadership experience. So if you look at the nurse manager and leader, the CNML, through the AONL, the requirements are that you have your bachelor's, not your master's. You don't have to have a master's. You have to have your nursing license and at least 1 year experience as a nurse manager or leader. So this is a certification exam. So if you are a member, it's 300. If you're not, 425. And in almost all certification exams, that's familiar. You get a cost decrease if you're a member of the professional nursing organization, and you pay a little bit more if you're not. If you are going for the CENP certification through the AONL, that's your certified executive in nursing practice. That's a higher level. It does require your MSN and 2 years experience in an executive nursing role. So that's going to be the difference. Most of you probably will be interested in the CNML. So I've put the handbook here if you're interested so that you don't have to download that yourself. But when you go on to this link of the AONL, you're going to be able to see those 2 different certification exams. So that's what you're going to be looking at. And between the certifications, between the doctoral education, and between the professional nursing organizations, just reviewing that information, seeing what interests you, thinking about what your future goals are, you're going to respond to discussion board 3. So in discussion board 3, you're going to describe the relationship of professional development to knowledge, attitudes, and competency, and the importance of continuing education and certification to the nursing profession. And you're going to share your own interest. What are you interested in as far as continuing? Are you interested in continuing your formal education? What program would you be interested in? A DNP, a PhD? Are you interested or already have certification? Maybe you'd be looking at the AONL's certification. Maybe you're going to be looking further at the CPPS. And what about membership in professional nursing organizations, current or future? Share a little bit about your own interest in your future, and also if you are certified and members already in professional nursing organizations, please share that. No replies are required this week, but I do ask that you post by Friday evening. So here it says Friday. So, and this will help you, this discussion board will help you put together a good chunk of your final course reflection. So I hope you have a great week. Be continuing on, completing your precepted clinical hours with, and make sure that all the practicum modules are being completed as well, so that when we get to week 6, which is a shortened week, we're going to be finishing up this course. So we want to make sure that everything is done in those 3 areas. Your learning units, your final course reflection is part of your learning units, and your practicum modules, and your precepted clinical experience. Talk to you soon.